Let me repeat something I just repeated because I checked the email. There's some people that don't believe it. I'm blue in the face saying this, too. So for those of you who have heard it and understand it, please indulge me. If you're a small business, if you are a corporation, major corporation, let me put it, that's a different way. You are an employee, small business or a big company, and you have your health insurance via your employment. The president went out there today and said, nothing's changing. You get to keep your doctor. If you like your plan, you get to keep it. No, because here's why. What was upheld today was the concept that you must buy health insurance or pay a fine for it, just not under the Commerce Clause. And the way that was arrived at was a tax on behavior. If you refuse to buy, there is a tax. Now, as the law is written, the tax for not buying health insurance is much cheaper than the cost of a policy. So if you work for a business, large or small, that wants to save money, and which business alive today doesn't because of the economy, if that business has an opportunity for the next year or two, maybe 3, I don't know when the numbers change, but certainly for the next 2 to 3 years after implementation, if the fine is $800 or $900, the cost of an insurance policy for an employee is $5,000, what are you going to do? You offload coverage and you say to the employee, sorry, I've got no choice. I have to stay in business. I'm paying the fine. You're on your own. Now you can go to the state exchange down there at the government office and you can buy health insurance from them. And you can try to get into a pool there, but it makes no sense any longer for us to offer these expensive policies. Now, that's not the case for the entire length of the law. It's very seductive. The fine is much, much cheaper than the cost of a policy, but only for 2 or 3 years, maybe 4. At that point, they catch up with each other because the thinking among the people who wrote the law is it'll only take 2 or 3 years for businesses to offload their health care coverage as an employee benefit. Then it all evens out. And then the fines for not having a policy get larger than the cost of a policy. This is all written into the law. And it happens in elements. It doesn't all happen in 1 year, but as each year goes by, the fine goes up. But for 2 or 3 years, it's much lower than the cost of the premium is. Then they catch up with each other, and then the fine overtakes the cost of the premium. And all of this is by design, to get people out of the private insurance market. Hill.com, CBO. CBO report says healthcare law could cause as many as 20 million to lose coverage. This was from March 15th of this year. As many as 20 million Americans could lose their employer-provided coverage because of Obama's healthcare reform law, said the CBO. And precisely for this reason. This is also where the discussion of jail time enters the discussion. In the original bill, there was a possibility of jail time with the fine. And I remember Pelosi was asked about this. And she thought throwing people in jail for not having health insurance was very fair, because she believed in the incentive staying out of jail to cause people to go out and make sure they're insured. Now, I don't know what this decision has said about that. It's 194 pages, and I haven't talked to anybody yet who's read the whole thing. I haven't read it myself. I've got the PDF file, but I haven't obviously had a chance to go through it all. But that 20 million figure, by the way, that the CBO is admitting to is very low. It's going to be many more than 20 million people who will lose employer-provided health insurance and who will then be forced to go elsewhere to get it. And if you don't, there's the fine. That's what happened today.